In our last video, we have been discussing about how to approach the mature cataract in our patient. Welcome back to ophthalmology for undergraduates and postgraduate beginners. In this video, I am going to talk about how to approach immature cortical cataract in our patient in the other eye. Now, let us see how to manage a case of immature cortical cataract. This management holds good for managing a case of nuclear cataract grade 1, 2 and 3 also. So, how to manage? If the visual acuity of the patient having the immature cataract is less than 6/60, we have to advise the patient for cataract surgery with IOL implantation. If suppose the patient says, I don't want to have surgery now, I want to postpone it, or the patient is having certain physical illness, he cannot get operated immediately, then we have to go for spectacle corrections for the patient. Spectacle corrections for the patient. If the vision improves with spectacle correction, then you can ask the patient to wear the spectacles for certain time, and you have to review the patient as often as possible so that the patient can undergo surgery at the earliest. Suppose you are trying with spectacle correction, patient does not improve with spectacles, then there is no other option. We have to plan for surgery in our patient. In our patient, we have shown in the video before, the visual acuity in the right eye which is having the immature cortical cataract was only counting fingers close to the face. In such a situation where the vision is very much low, we have to advise the patient for cataract surgery at the earliest. You must be wondering why I have taken the cutoff limit of 6/60, whether to undergo a surgery or go for spectacle corrections. A vision less than 6/60 is called as economic blindness. The patient will not be able to earn his livings. So, it is advised to operate a patient whose visual acuity is less than 6/60. We have another situation now where the visual acuity in the immature cataractous eye is better than or more than 6/60. What should we do? Suppose a patient's occupation needs crystal clear vision, that is very good vision, like a police, an army personnel, a person who is doing work in the factories. So, those people who need very good vision to do their work, they need to undergo cataract surgery immediately, because if you don't do surgery for them, this immature cataract will affect their vision very much in doing their normal work. Suppose the patient does not have any such occupational needs, then what we should do? If the patient wants surgery, then we can go in for surgery. Patient can decide what he wants. If the patient does not want surgery now, or the patient is having some physical illness for which the surgery has to be postponed for certain time, then patient can be subjected for spectacle corrections. If the visual acuity improves with spectacles, then the patient can continue with spectacles for some time. During that time, you can review the patient, and if the visual acuity falls below 6/60, you can always advise the patient to undergo cataract surgery. If the patient does not improve with spectacle correction, then you have the option to advise the patient for cataract surgery now itself. Now let us see how to give spectacle correction for a patient. The steps are, first you should check the visual acuity with the pinhole. Pinhole is a 1.2 millimeter diameter hole in a black disc placed in front of the patient's eye, and you ask the patient to read the Snellen's chart. If the visual acuity improves well, then it shows that spectacles can improve the patient's visual acuity. Next thing I want to do for these patients who are elderly is to check the blood sugar level of the patient. The blood sugar you have to check both fasting and postprandial. You check it both fasting and postprandial. If the blood sugar is within normal limits or it is under control. I want the postprandial blood sugar to be less than 200 milligrams percent and fasting blood sugar to be less than 150 milligrams percent for giving a glass prescription for the patient. Suppose the blood sugar level is very high, more than 200 milligrams percent, then the increased blood sugar level will alter the refractory power of the eye. In such a status, if you prescribe spectacles for a person, then when the patient's blood sugar level comes to a normal limits level, the glass you have prescribed may not give good vision for the patient. So it is always advised to bring the blood sugar under control before giving a glass prescription. The next thing is fundus examination. You should do an ophthalmoscopic examination to check whether the retina, macula, optic nerve, the media of the eye, that is a vitreous, everything is normal or not. If they are normal, then there is no negative points in giving a glass prescription for the patient. The next step in the glass prescription stage is doing a retinoscopy or the autorefractometer. What is this retinoscopy? Retinoscopy is nothing but an objective estimation of refractive power of the patient. We use a retinoscope to find out how much of power deficit is in that particular eye. Then that power deficit can be used for giving a spectacle correction. Nowadays, people have started using autorefractometers. You must have seen in many optical shops. Even now, all the ophthalmologists are having an autorefractometer. They will ask you to keep your chin in a machine and look at a picture in the monitor. So, when you look at the picture there, they will track the autorefractometer and measure the power deficit in your eye. So, after measuring the power deficit in the eye, next we have to go for a subjective testing. Now you ask the patient to read the Snellen's chart with the corrective spectacles or powered lens, corrective powered lens. So when the patient reads the Snellen's chart, you make adjustment in the power of the lenses kept in front of his eyes according to the power derived in the retinoscopy or autorefractometer. Then we try to arrive at the exact power required for the patient's eye to get the maximum visual acuity. So that is called as subjective testing. Once you have come to a conclusion, this is the power for that eye, then we can go ahead with spectacle prescription for the patient. All these steps I have told is only for correcting the distant vision. As an elderly patient who has lost the accommodation in the eyes, the near vision will not be clear because of presbyopia. So these patients should be given additional power correction for doing the near work or reading purposes. If it is decided to do surgery for a case of immature cortical cataract or grade 1, 2 and 3 nuclear cataracts, there are two situations. One is the cataract is not so dense, the fundus can be clearly seen with an ophthalmoscope. You do ophthalmoscopy and you are able to clearly see the retina, macula and optic nerve, and they are very much normal, then you can proceed with the surgery. If you don't see the fundus with your routine ophthalmoscopy, then you have to make sure the retina, macula and optic nerve are normal with an ultrasonogram, that is a B scan, which says whether anatomically the posterior segment is normal or not, and to find out whether those posterior segment structures are functioning normally, we have to do a macular function test, retinal function test and optic nerve function test. This we have already discussed in our approach towards the mature cataract management. So, whenever you want to do surgery for any cataract, whether it is a immature cataract or a mature cataract, you want to do surgery for any grades of nuclear cataract, all the steps are same as in the previous video. The only point where we differ is this fundus examination. If the fundus examination is possible, no need for doing these tests. If the fundus examination is not possible, we have to do this test to confirm the posterior segment is normal or not. So, this is a major difference. All the other things are same. Now we have evaluated everything in the patient towards surgery. Now what surgery has to be done? The patient is having an immature cortical cataract or grade 1, 2 or 3 nuclear cataract. You have to do a extracapsular cataract extraction with IOL implantation. In the mature cataract, I told the lens will be very hard. So there a manual small incision cataract surgery is preferred. But in case of an immature cortical cataract or early grades of nuclear cataract, because the lens will be little bit softer, we can always go in for phacoemulsification surgery. So phacoemulsification surgery is an advanced surgery. We can always decide about going with this surgery. We can stop here today. In the next video, few more things we have to learn about this cataract. So we will see in that video. Thank you.